Good afternoon, everyone, and welcome to this presentation with Dr. Iniguez. She's going to tell us some helpful tips for how you can kick the smoking habit. So I'm going to let Dr. Iniguez take over.
Hi, Stacy. Thank you very much for inviting us to give this talk. First of all, I want to introduce myself, Marlette. Working in a new office for Wilmot Cancer Institute here in Rochester. We are located here in Rochester, but we are a new office, and our main goal is pretty much reach out to the community and hear from the community what are the needs in order for us to provide new ways and new programs for all the community. And one of those, because our main goal is cancer and everything related to cancer, and one of those things is cancer prevention, right? And so all the research that we have done, we know that one of the main risk factors for people to develop cancer is smoking. So our goal right now, currently, our main issue and one of our main activities that we have is help people quit smoking. So I want to talk a little bit about smoking and just a little bit of data. About 34 million American adults still smoke currently. And smoking, it's not only in cigarettes, right? There's many tobacco products, as we can see: cigarettes, cigars, cigarillos, pipes, hookahs, electronic cigarettes, right? That is something that it's really common now. It's getting into the trending, and everybody's trying to do it, and because it's something new. And the other one is chewed tobacco too. So what does the cigarette contains? The cigarette contains up to 7,000 chemicals that we don't even know for sure what are they, right? These are only a few that we know because they are really dangerous for the body, right? One of those is arsenic, for example, that we know is used for poison. Carbon monoxide is also a poisonous gas that goes to our system once we start smoking. Methanol, paint, ammonia that we use for cleaning products, right? For the toilet specific. Nicotine, that's one of the, it's the main reason why people get addicted to cigarette, right? Because nicotine, it goes to your brain and it sends you all those happy chemicals to your brain, right? Saying that you're happy and that you are okay and you feel energetic and you feel that you're thinking better because of the nicotine. Toluene, all other acetic acid, for example. So yeah, cigarette is very dangerous for our bodies. So what is the problem with cigarettes? The main issue, and I think in a long way thinking, and especially for people that they have been smoking for a long time, is cancer, right? We know a lot of research has been done about all the related cancers that you can get because you smoke. Heart disease is another one, heart attacks, aortic, all those things, it's because of smoking. Strokes, lung disease, COPD, asthma, cancer, lung cancer, diabetes, and currently COVID-19, right? We know that people that used to smoke or that they are smokers were really, really bad hit because of COVID, right? Because they were already like doing bad with the lungs, and then they got this disease and it was horrible for them. So reasons for you to quit: your health, right? It's the main reason. In the program, we have a lot of participants currently in the program, and we have the privilege to talk to them. And one of the main reasons that they say that they want to quit, it's because of the health. Other one is the family, right? It's really important. A lot of people wants to quit because, I don't know, their daughter is waiting for a grandchild, or I don't know, the nephew or nieces or the son or the daughter. The appearance is another one. My pets. There's a lot of people that says, "Oh, I want to quit because of my doggy, because my doggy lives with me and she's with me all the time." And secondhand smoke, it can really hurt the pets too. Save money is another one, and also to be proud of themselves. So the risk for smoking, as I told you, one of the main reasons is cancer in the long term. And we have seen that smoking can lead to cancers of head and neck, lung cancer, of course, leukemia because of the you're hurting your blood once you start smoking, because all the other components of the cigarette, like I told you, stomach cancer, kidney, pancreas, colon, bladder, or cervix cancer too. But other than cancer, we can also get chronic diseases like stroke, blindness. You can get blind because of the cigarette and all the components. Gum infection, also, you can lose your teeth. You can get other infections other than your gum, throat infections, tongue, all those things. Aortic rupture, heart disease, pneumonia, hardening of the arteries, so that can lead to a stroke or to a heart attack. Chronic lung disease and asthma, and reduced fertility for people that they start smoking when they're young and they decide to start having kids. Sometimes it's hard for them to get pregnant or to conceive. And also hip fracture, because your bones get osteoporosis. So how can I quit smoking? All the research that we have done, and a lot of people and a lot of doctors and scientists have done this research, and they came to a conclusion that there's a lot of ways to quit, right? There's people that can quit cold turkey. There's people that quit only using medication. There's people that quit only using counseling. But what they have learned is that doing two things can help to improve and to get a better understanding and to a better success of quitting. Another thing is, more than time, if a smoker tries more than once to quit, it's a better chance for them to quit also. So our program is focused on counseling and medication, right? So us, the Wilmot Cancer Institute, are here, and we are willing to help all the smokers that want to quit. I don't know if I mentioned, but Wilmot Cancer Institute has a 27 counties catchment area. So we are not only focusing on Monroe County, that is here in Rochester. We are open to the 27 counties. And why? Because our program is it has the capacity to go all over the 27 counties, because everything is over the phone. So like I told you, we have the program that consists in text messaging support. Why text messaging? Why, what we have learned in this, I don't know, few years that we have developed this program, is that there's a lot of people that it's, especially pre-COVID, right? Because pre-COVID, we were targeting to see people in person, but there's a lot of people that they're busy, the job, the family, it's hard for them to join a program, and especially to make an appointment with you. So we develop a text message support system. It's a platform where we enroll the participants, and they can start, they receive text messages and they can reply to those text messages. Everything is personalized and everything is free. We don't even charge for the program or anything. So they can just be interactive, right? I don't know they're busy at some point and they cannot pick up the phone and talk to us, they can just text and reply to the text message and receive the text messages. And also we can offer the nicotine replacement therapy. We have 3 available things in the program, that is the patches, the gum, or the lozenges. We can combine, we can use, I don't know, the patches and the gum, or the patches and the lozenges too, depending on each participant and on each person, the amount of cigarettes, all those things. And other thing is that the program is available in English and in Spanish. And like I told you, the 3 components of the program are totally free of cost. We don't even ask for insurance or anything. And in this case, the patches, the gum, or the lozenges, we ship those to their homes, so they don't need to go to a pharmacy or to I don't know, to the hospital or anywhere. We send everything to their house. So once you quit, right, the effects of quitting smoking, 20 minutes after you stop smoking, your heart rate and blood pressure drops. So imagine what can happen once you quit smoking. So just 20 minutes after that, your heart rate's gonna drop. 12 hours after you stop smoking, your carbon monoxide level in blood also drops to normal. Like I told you, carbon monoxide is poisonous gas that it's going through your system when you smoke. Circulation improves, lung function increases to 2 to 12 weeks after you quit. 1 year after, the risk of coronary heart disease and half of that of a non-smoker. 5 to 15 years after you quit, risk of stroke reduced to of a non-smoker person, and all the convenient things once you stop. But I think what is really amazed for me, it's that 20 minutes after you quit, your system is already processing, it's already healing of, even though you probably you smoke for a long time. So here's another sample. 20 minutes, 8 hours, carbon monoxide reduced. 24 hours after you quit, all the mucus and drifts caused by smoking being to clear out. So that's why some people, when they quit, they start coughing a lot and they think, oh, I'm getting sick probably because I'm quitting. No, they're coughing because their lungs are trying to push out all the mucus and all the things that were there in the lungs. So how to contact us to be in the program? Thank you to Stacy. We are gonna be at the library every Tuesday from 11 to 3 p.m. So if anybody wants to come and join the program and ask us more questions about the program or anything that they need, a family member or whatever, we're gonna be there. And also we can send flyers to everybody if they want. But this is the telephone number to reach us and also the email. And yeah, that's pretty much it. You muted. You muted.
Sorry about that.
There
I forgot there was something noisy happening in the library and I forgot that I was muted. Thank you
No problem
for telling me all that. So hopefully some of you who have been watching will come over to the Macedon Public Library on Tuesdays, meet up with Arlette. She can answer your questions and she can sign you up for this great program. And you can get off cigarettes and you'll be on that timeline towards healing and reducing risks for things like cancer. So I welcome you to come on Tuesdays. Thank you, Arlette.
No problem. Thank you, Stacy.
Bye.
Bye-bye.